As the spread and death toll from COVID-19 rises, Minister of Health and Wellness Dr. Christopher Tufton and his team underscored the importance of adhering to COVID-19 protocols during a press brief on Monday, January 25.
Major hospitals in Manchester are now at the amber and red alert levels. The Mandeville Regional Hospital and Percy Junior Hospital are at 76 and 83% occupancy respectively. This news comes amidst the announcement of new curfew orders for the parish. New statistics show Manchester with COVID positivity rates 3 times the national average. Citing non-compliance with the government's preventative coronavirus measures, Cabinet has, with advice from the Ministry of Health and Wellness, decided to enforce enhanced COVID-19 measures. These measures take effect Monday, January 25 and will last for 2 weeks, ending on Monday, February 8. Speaking Monday at a virtual COVID-19 press conference, Health Minister Dr. Christopher Tufton said in the last 2 weeks, Manchester has accounted for over 11% of all confirmed COVID-19 cases across the island.
Manchester has seen a rapid increase in cases, with 125 new cases between January 10th and 24. In addition, the cases are spread across the parish, with over 30 communities affected. There is non-compliance to infection prevention and control measures, as many persons are not wearing masks, and there is more crowding and gatherings that are observed on the ground by the surveillance team. The parish of Manchester accounts for some 11.3% of all confirmed COVID-19 cases in the last 2 weeks, and presently 5.3% of the total confirmed cases ever for the country are in that parish. The positivity rate for the parish has been the highest in the last 2 weeks, which is now over that period has been approximately 28% or 27.8%, and it is 3 times the national positivity rate, which stands at some 10.8%.
The parish now ranks 9th in overall deaths per population. The health minister says increases in hospitalization as a result of respiratory issues aided the ministry in making the recommendation for increased restrictions in the parish. Dr. Tufton says the aim is to not overwhelm the public health system, as doing so would result in persons not receiving care.
The health team in the parish has reported an increase in the number of persons presenting with symptoms of COVID-19 at health centers and the hospital. Contacts of these persons are also found to be positive when contact tracing is carried out. 85% capacity. This is compared to 78% for the Western Regional Health Authority, 61% for Sierra, and 56% for the Northeastern Regional Health Authority. So there is an increase in hospitalization.
In keeping with the Disaster Risk Management Act, the curfew hours for Manchester are as follows.
The curfew hours for Manchester will begin at 7 p.m. this evening, that's Monday the 25th of January, and end at 5 a.m. on Monday, February 8th, 2021, with persons allowed to move about between 5 a.m. and 7 p.m. each day. During the period, gatherings in a public place should not exceed 10 persons, and markets and vending in public arcades and public transportation centers are only allowed between the hours of 6 a.m. and 6 p.m. Additionally, between January 25th and February 8th, 2021, public transportation authorized by the Transport Authority Act will be allowed to operate between 4 a.m. and 8 p.m., and no passengers being transported between the hours of 4 a.m. and 5 a.m. and 7 p.m. and 8 p.m.
The Health and Wellness Ministry has also indicated concern for the parishes of St. James and St. Anne. Dr. Tufton says these parishes will be monitored using local public health teams. The health minister urged Jamaicans to be mindful of COVID-19 protocols. For the news on PBCJ, I'm Gabrielle Thompson.